The United States of America is one of many developed countries that gives healthcare services to their citizens. Our healthcare system consists of businesses supplying coverage, both private and public health insurance. In the recent years, I have made the observation that healthcare is a consistent topic brought up through different political leaders and government officials. Both have suggested ways to see what best fits for the American people and our health, trying to understand ways in which citizens can afford such an expensive visit to the doctor's office. In my opinion, having healthcare has always seemed like a privilege to have. In the photo shown, you can see the determinants of what comes with receiving healthcare. It has always been something that is constantly changing, but seemingly growing at a fast rate to the point where it becomes harder and harder to receive. But for who exactly? In the next photo is a graph of who has healthcare coverage. This graph is collected by showing the percentage of people divided up behind their race that did not receive healthcare in the given year due to the cost of it. Among other things, cost has been a dominant factor in the result of poor healthcare and poor health for people of color. Black, Hispanic, and Asian Americans that come from low-income communities find a resistance and challenge to receive proper healthcare due to the cost and potential interactions with their white counterparts. What people have failed to realize is that there is an implicit bias that lies among healthcare workers, leaving people of color too afraid to return into a setting where they could potentially be discriminated against. The health of people of color has been jeopardized, leading to mistrust in the medical community, which is continuing to grow. Beyond regular health checkups, the ongoing pandemic for coronavirus has been such an impactful disaster to everyone in the US. From immediate lockdown to mask wearing and social distancing, COVID has left its mark on everybody. The COVID-19 vaccine distribution has begun among many communities that has factually hit people of color and their communities harder than their white counterparts. The deadly virus has led them to being more sick, causing death at a rising number. When it comes to the distribution of the vaccine, you would imagine the case being that those who are impacted the hardest may receive the vaccine to prevent rising numbers and deaths and giving them the greater good. The current distribution plan of COVID-19 vaccination is a system based on prioritized groups. To not see the lack of attention for people of color in the medical community is turning a blind eye, and calls to understand the struggle of Black, Asian, and Hispanic communities and what they face just to receive healthcare.